Examine the urinary tract and interpret the lab findings. So steps. Look at the history, the physical examination, use inspection, and the ancillary diagnostic methods. So number 1 is rectal palpation, and number 2 is ultrasound. For the kidneys, you can use transabdominal for both, or for the left one you can use transrectal. And cystoscopy, X-ray, and scintigraphy. And you can use lab methods as well. Hematology is number 1, number 2 is serum biochemistry, and number 3 is urinalysis. So history, is there urination? Is it pain, frequency? Urine, look at the colour, the consistency. Number 3 is the water intake. Number 4, was there colic? Is there weight loss? Is there decreased appetite? Examine the organs. So palpation. Look at the genitals first. For the penis, look at the fossa urethralis, the sinus urethralis, the ureter, and the prepuce. For the vagina and the vulva as well. And the kidney, rectally, you can only feel the left kidney, the most caudal part of the left kidney rectally. And feel the size and shape. And the ureter, rectal, is only in pathological cases. And the bladder should be between the size of a hand and a football. The urethra, in the mare, the vaginal speculum is the ventral midline, the vestibule. And in stallions or geldings, you need sedation for xylazine. Do not use asapromazine as it causes penile prolapse. And examination of the urination. Put in a fresh, stable state. Normal. Look at the posture and the behavior of the horse. Is it streaming? Is it dribbling? Use multiple small portions. The amount should be between 10 and 30 milliliters per kilogram per day. And the frequency should be between 4 to 7 times per day. Abnormal is polyuria or polydipsia, oliguria, or anuria. This is caused by acute renal failure, blocked urethra, bladder rupture, and dysuria is pain, and incontinence is when it can't control the urination. The lab findings, so hematology is mild anemia in kidney failure is caused by decreased EPO, decreased hematocrit, or increased neutrophils. The serum biochemistry, so the urea should be between 3.6 to 8.9 milliliters per liter, and the creatine should be between 71 to 194 millimoles per liter, and urea creatine ratio, if it's less than 10 it's acute, if it's more than 10 it's chronic. And the urine analysis, so the color, the odor, the viscosity, the clarity. Use a urine dipstick. It's used in humans as well. Sediment examination, the specific gravity and the fractional clearance and tubular function. And you can use the bacteria culture as well. And the specific gravity refractometer. So hypostenuria is less than 1008. This is normal in adults. Isotenuria is 1008 to 1014. And hyperstenuria is over 1014, and this is normal in newborns. And it's also increased dilution in adults. The clearance of electrolytes is 0.03 to 0.5% of sodium. For potassium, it's 15 to 70%, and in chloride, it's 0.2 to 1.7%. In chronic renal failure, there's poor performance, there's lethargy, and there's weight loss. And urolithiasis, there's geldings, it happens more than the mare.